Okay, I'm Tamika, and I'm going to do an IV insertion and an IV push. So I'm going to go in the patient room now. Hello, I'm Tamika. I'm going to be your nurse. I'm coming to do your IV insertion, and I'm going to give you some IV medication, your morphine. It's going to be zero point 0.5 milliliters. Can I have you verify your name and date of birth?
My name is Ivy Armstrong, date of birth 3/26/64.
Okay, thank you. Have any allergies?
I'm allergic to latex.
Okay, thank you. So I'll be back. I'm going to go get your medication and get my supplies, okay?
Okay.
So, so now I'm in the med room. So I have her medicine. I'm just going to give me some gloves. Is this some gloves? There's some gloves right here. Have some gloves. I want hand sanitizer. And then I'll put on my gloves here. And we're going to do 0.5, so I'm just going to get the needle together. Let me wipe off the top of this vial here. And then I want to verify her order. So I looked up the MAR, and it has her IV Armstrong 0.5 morphine. So now the medication is not expired or anything. And I'm going to do the top of it for 30 seconds, 28, 29, 30. And I'm going to, she's going to get in her IV. It's the right time at 0600. And we're going to open this up here. And we're going to attach our needle, get everything in there started. So let me put that on here. And then I'm just going to do the one half, draw back the air here. And then I'll be able to take this up. I'm going to inject the air and the morphine here. And then we're going to draw back one half. I'm just going to hold it up here so I can see it. There we go, perfect. Okay, now we have that. I'm going to recap this so we can take it to her room here. Okay. And then I have all of my IV stuff, so now I'm just going to go back to her room. And then so we have IV Armstrong, a half a milliliter of morphine for 0600. And we're going to get it to her, so I verified that. Okay, so now I'm going to go back to her room. Hi, Ivy, I'm back. I have everything for you. Can I have you verify your name and date of birth again for me?
My name is Ivy Armstrong, date of birth 3/26/64.
Thank you. And then I'm just going to put some hand sanitizer on. Can I raise your bed up, Ivy, a little bit?
Yes, you can.
Okay. Thank you. I'm going to raise your bed up. Thank you. And the first thing I'm going to do, Ivy, is I'm just going to, my hand sanitizer again, put on some gloves. I'm going to try to find a vein, okay? And so, and then I'm going to let your bed rail down. Hand sanitize. And this is in the room, and I'm just, let me grab some gloves here. First thing I'm going to do, I'm going to try to find a vein on you, okay? Is it okay if I use this side of your arm?
Yes, that's fine.
Okay. And we'll use this side. There's no mastectomy, no fistula, no contraindications on why I can't use this side. So I have my tourniquet here. You Ivy, raise your arm for me, Ivy. Okay. Put it 2 to 3 inches above where we'll be putting the needle at. So make it tight. Tie it tight here. Okay, then I'm just gonna feel for a vein. But just for the record, normally you'll start the most distally and then you'll work your way up. So I can, you know, move this lower since, and then start distally. Okay. And so I have a vein here, so I'm gonna leave this and make it loose so I won't cut off your circulation. And then what I'm gonna do is I'm gonna pop this chlorine and clean it, scrub it viciously for 30 seconds. Okay, and then that's going in the trash. So now I'm just gonna get a little help here from you, the patient. Man, put this in your hand here. Just hold that for me. I got my J loop, and I think that's it. Yeah, and my needle. Okay. So I'm just gonna connect. I opened this up out the package too. This was in the package, so I'm just gonna connect this on here. Make sure that's on there, and then make sure that it, you know, there we go. So it looks good. I don't know why mine's. I think the J loop is just old. Yeah, so there we go. So it looks good now. Got the air bubbles out. Okay, now we're going to, let's open the needle up here. We're going to get that open. Okay, and I'm going to make this tight here so I can get it in there. Oh, you know, I know what I'm missing. I'm missing my tape and adhesive. So let me get that. I'm gonna get it, Ivy. And well, press your call button. Okay, I'll call the nurse. Okay, call the nurse. Hello, can I help you? Yes. Can you grab the adhesive? This is Nurse Tamika. The adhesive and the IV sticker, the tape and the IV sticker.
Excuse me.
Corey.
Can I get the...
So I'm waiting on my colleague here to
Yes,
bring
that.
in
And the tape.
that. So
Here you
I
go.
oh, thank you. Okay, so I have your sticker, and then I'm gonna put a piece of this tape on my hand here, so we'll just be able to secure that down. Okay, so now I'm gonna open the needle with the white part of it up, grab the sides here. I'm just gonna anchor the vein here, and then you're gonna feel a little stick, Ivy, okay? Alrighty, and then so hope this go in. Okay, trying to find some secret hidden. It's gonna be a little flash of blood, should be, or not. Oh, there it goes. Okay. So I see a flash of blood. Then I'm going to stop pushing. So I'm going to grab and push the blue catheter on in. And then I'm going to take the needle out. So I hope I can do it like that. And then I'm going to get my J loop here. And we're going to secure that on there. And then, so I'm still holding that. I'm just going to take the tape off here and put it on here to secure that. Okay, now I'm going to get my gauze here and just wipe up the excess blood, and then I'll be able to put on your IV secure tape here. But I'm just going to flush it here And then make sure, so it's draw back. We got blood in there. They're just gonna, okay, so it's good. And then I'm gonna put this on like a pair of pants where the IV can be kind of exposed. I'm gonna put the needle in the sharps over here. This is the sharps. And then, ooh, my back hurting, Abby. Okay. Oh, it do go like this. I'm gonna put this on right here so that the, you know, the catheter, the site is, so you can see it through the window there. And then we can peel this excess off. Gotta get it off with the gloves here. Did this thing just come off like? Okay, I gotta really peel it off like a, there it go. Okay. Perfect. Okay. And then we'll be able to secure it with this. So then I can take off my little strap of tape here. Sorry, I pinched you. Sorry. It's hard to do with gloves on. Okay. Then I'm just gonna loop this around here. And then I'm gonna flush it and lock it. So I'm locking while I'm flushing. So it could be positive pressure. Okay. Okay. And then I can take this off if it wants to come off. Okay, there it goes. And then I'm gonna put my initials and the time and date on here and my initials, and that's with that. And so I'll be able to throw this out. Okay, Ivy, thank you for your patience. I'm just going to give you your medicine now. So can I have you verify your name and date of birth again for me?
Ivy Armstrong, date of birth 3/26/64.
Okay, so that's my third check there. And so I'm just going to clean off this. But normally, Erin, I forgot to release her tourniquet, but I will release the tourniquet right after I get my catheter in. So I'm just going to clean this for 30 seconds and then 29, 30, and then I'll be able to flush it. Here's a flush here. So just make sure that site is good. I'm checking for any, unlock it, checking for any discoloration or any signs of discomfort or infection. Okay, so now it's flush. So now we can get another alcohol wipe and clean it again here. And then I have the medicine here for you. So I'm gonna bevel side up. Oh. Oh, okay. So I'm going to oh, you don't put the needle in there? Don't put the needle in there. Oh, so I'm going to give you the medicine here. So we're going to put that in and screw that on, and we're going to push it slowly over 1 to 2 minutes. I'm taking my thumb off so I won't keep pushing it. Did you all really pretend to do? Okay. So it's pushing 1 to 2 minutes, even though I'm just pushing it straight in. That was 1 to 2 minutes. And then what'll happen now is you'll alcohol wipe it. So I'll get another alcohol wipe, wipe that off, and then we're gonna flush it at the same speed for 1 to 2 minutes. So we're gonna just flush it, and then while we're flushing it, we're gonna lock it again for positive pressure lock. So that's that. And then I'm going to clean up my mess here. Gave her all the medicine. Throw away all the hazards. All right, and then Ivy, is everything feeling okay? Are you doing good?
Yes, I am.
Okay, so I'm just gonna lower your bed. There you go. And then I'm gonna raise your rail up. Do you have any questions or anything?
No, I do not.
Okay, you need anything right now?
No.
Here's your call light. Okay, and then I'll be back in an hour to check on you. I'm gonna take my clothes off and have some time before I leave the room. And I'll see you in an hour. Thank you.